welcome to the Brown Bag Lunch Training Series. This series is hosted by the Family Voices of California and brought to you by SF CARD, San Francisco Community Agencies Responding to Disaster. Today's subject is H1n1, how to prepare your family and your office. Hello.
Hi, Elizabeth. Let me jump in and just let people know a little bit about the technology in case they have any problems.
Sure, go right ahead.
Welcome to Elizabeth. Thanks so much to be here today. As we all know, children and youth with special health care needs are one of the populations at risk when it comes to H1n1. So today's webinar will hopefully give everyone a better understanding of what you can do in your office and in your home for preparing for this. And a few notes about the technology. Unless you're absolutely sure that you have a headset and a microphone that allows you to speak through your computer, you'll either need to call in or type in your questions. You can find the call-in number from your confirmation email, or while you're connected, you can go to the audio mode, select Use Telephone, and it'll give you a dial-in access and audio pin. And if you have any other technical difficulties, you can either contact GoToWebinar directly at 1-800-263-6317, or you can send me, Tara Robinson, a chat or a question. And owing to feedback issues, we usually have people muted from our end during the presentation. So when you have a question to ask, you select the little hand icon located in the control panel. It's a small column to the left of the menu. It's a little hand with a green arrow. If you click that, then we know you want to be unmuted and you have a comment or a question. And then if you ever have any trouble being heard, you can always type in your questions. And we're going to provide the opportunity to ask questions at the end of the presentation. So if you have questions that pop up for you, either send them to me or just jot them down. And lastly, we will be emailing everyone a link for the video of this presentation and the PowerPoint slides afterwards. It's a question we always get. So with that, I'll turn it over to Elizabeth. Thanks so much for being here.
Hello. I'm Elisabeth Whitney. I work for SF CARD. We help agencies prepare for disasters. My background is in public health and tropical medicine, but I do want to point out that I'm neither a physician nor a lawyer. So if you are looking for specific medical or legal advice, please address your inquiries to the appropriate specialist. So let's find out more about the swine flu outbreak. Also, would you hold your questions until the end, please? Thank you. Pandemics are rare events, and almost all of our knowledge about them comes from the data and information obtained from studying 4 events over the past 120 years. The 1889 Russian flu pandemic, the 1918 Spanish flu pandemic, the 1957 Asian flu, and the 1968 Hong Kong flu. We're not sure how severe this flu season will be. A mild season, like the 1957 type Asian flu pandemic, which was first identified in China, caused about 2 million deaths worldwide and about 70,000 deaths in the United States. The Spanish flu, a more severe flu, was first identified at Camp Funston in Kansas. It infected about a third of the world's population, or at the time, about 500 million people. In the US, about 675,000 people died as a result of this infection. Recent studies by the CDC speculate that the strain of virus was the H1n1 or the swine flu. So what is H1n1 or swine flu? The H1n1 or swine flu is a new influenza virus that has caused illness in people worldwide. It was first detected in people April 24th of 2009 and has since been declared a pandemic. In past pandemics, influenza viruses have needed more than 6 months to spread as widely as the H1n1 virus spread in the first 6 weeks. In addition, it's a novel flu virus because it's unusual for a virus to show up in the summertime. It is now established in our community, and there is very little immunity in the community to it. Influenza is a highly contagious respiratory disease spread by tiny wet droplets produced when a person coughs, sneezes, or talks. So please cough or sneeze into your sleeve. And when I say that, I mean you you cough into the inside of your elbow, and we call that the Dracula cough. Or cover your mouth and nose with a tissue when sneezing, coughing, or nose blowing, and then throw the tissue away in the trash after use. What we're trying to do is to avoid getting the virus on our hands, and this is important because we touch our faces several times a minute. For poor cough hygiene, we need to clean hands with soap and water or use alcohol-based hand sanitizers. Clean frequently touched items and surfaces with soap and water or sanitizer again. And alcohol-based hand cleaners, 60% alcohol, are good. Also, don't share personal items like toothbrushes or drinks. So when are we contagious? A summer study at the U.S. Air Force Academy in Colorado Springs last year found that people were still shedding live virus for up to 7 to 10 days. However, the recommendation is that you should stay home when you're sick and remain at home until at least 24 hours after you're free of fever. And of course, don't travel with the flu. Please stay home if you're sick. So let's talk a little bit about what influenza is and typical versus epidemic conditions. Every year, 10 to 20% of the world's population gets influenza, causing anywhere from 500,000 to 1 million deaths. In epidemic years, 25% or more of the population get it. In the US, the annual seasonal flu results in about 36,000 deaths and 114,000 hospitalizations. And some 90% of the people who die during a regular flu season are over 65 years. By contrast, the swine flu affects our younger population. So who is more likely to get very sick with the flu? People with lung disease like asthma, people with other medical conditions like diabetes, heart disease, kidney or liver disease, blood cell disease, including sickle cell, or neurological diseases that affect swallowing or breathing, pregnant women and women who've given birth within the last 2 weeks, children aged 2 years and under, adults aged 65 years and over, and people with weak immune systems due to either diseases or medicines. Then what is of interest to us now is who's getting severely ill. At the moment, we're only doing lab studies on severe cases to confirm H1n1. 70% of all cases are in the 19-month to 5-year-old age group, and the highest rates of severe infection are in the less than 1-year-old group. As you can see from this slide, people with pre-existing underlying conditions like breathing disorders, smoking, and obesity are most likely to be susceptible. Again, note, the majority of people with severe complications have underlying chronic conditions. Also, it's important to note that the signs and symptoms of the H1n1 cannot be distinguished from regular or seasonal flu. So what are some of the symptoms for the H1n1? Well, fever, usually 102 degrees, but it can get up to 104 degrees and usually lasts 3 to 4 days. Headache, muscle aches, tiredness and weakness that usually last a couple of weeks, extreme exhaustion, and coughing. From this slide, you can see that fever and cough are the two most prevalent clinical characteristics, followed closely by shortness of breath, or the SOB acronym. So these are the ones to watch out for. This slide shows the course of influenza in adults. While people are actually contagious for about 6 days or so, published guidance recommends that a person should stay home until 24 hours after fever subsides, unmedicated. And what that means is with the fever gone, without using Tylenol or Motrin or ibuprofen. We do not have specific data on about children on this, but this data about adults should mirror what we would expect for children. This slide shows us the percent of visits for flu-like illness reported by the U.S. outpatient influenza-like Illness Surveillance Network. This shows the national summary of the 2008-2009 and the previous 2 seasons. What we're illustrating here is the pattern of visits to doctors, clinics or hospitals by people during a year's period of time. You can see where the spike is, and it is the season we are approaching. We are currently in week 1, January 6th, and this slide tells us that the peak of the flu season is the end of January and the beginning of February. Typically, a pandemic may last as long as 18 months, striking in up to 3 separate waves. Mortality and morbidity will increase and decrease in spurts. The second wave has historically produced the greatest number of deaths and illnesses. This slide is from the Pan American Health Organization, and this shows the number of cases in California as of the beginning of November 2009. Of course, now these statistics are reported. So there is a lag time on the numbers, and many cases are now going undiagnosed. This is from the CDC, and in August there were more than 10,000 reported confirmed cases in the US. This slide, also from the CDC, shows us the extent to which the flu has spread. Brown is widespread. From the World Health Organization, this is the laboratory-confirmed number of swine flu deaths as of November of 2009. There have been 1,401 severe cases of swine flu in California as of November 28th of 2009, and 366 deaths in California as of November 28th, again, of 2009. Novel H1n1 confirmed and probable case rate in the United States. What I want you to get from this bar chart is the distribution of the H1n1 by the age of the patients. This virus is not affecting the typical ages of patients. The age groups most affected are the 0 to 4 years and the 5 to 24-year-olds. Compared to the last slide, where 25 and 49-year-olds were less than 7% of the case rate, with H1n1, young adults represent one of the higher risk groups for hospitalization too. This is very different from seasonal flu, which affects infants and seniors most. So, we are uncertain how serious or severe the H1n1 will be in terms of how many infected people will develop severe complications or die, and how the virus may affect the US during the flu season this fall and winter. But reports from Sydney, Australia, which has now gone through its flu season in the Southern Hemisphere, indicate that the pandemic H1n1 influenza caused a 15-fold increase in admissions to intensive care units for lung problems in both Australia and New Zealand during the winter flu season. But the biggest difference is that about half of those hospitalized with so-called swine flu were children and teenagers. Because this is a new virus for the given population, there will be little or no immunity, resulting in more severe and widespread illness. Vaccines are available. With this new virus, the CDC speculates more cases, there will be more hospitalizations, and more deaths for this season. From the most recent guidance we're getting, the H1n1 vaccine will not protect against the seasonal flu. The FDA has approved the use of 1 dose of H1n1 swine flu vaccine for persons aged 10 years and older, and for children 6 months old to 10 years, they need 2 doses separated by 3 to 4 weeks, and it is best to use the same type of vaccine for the first and second doses. You may also get seasonal flu and H1 vaccinations at the same time, but there is a caveat with that, which I will explain later. If your child got a dose of the recalled vaccine for the age groups 6 months to 36 months, you do not need to have them revaccinated. It was recalled for potency, not safety reasons, which means that the concentration of the active component was not high enough to meet standards but it was still high enough to create a positive immune response. But the most important thing is to get vaccinated. The H1n1 vaccines are being made available to all persons current over 3 at the Department of Public Health Travel Clinic, 101 Grove Street, here in San Francisco, by appointment. You can call, and the telephone number's there, 415-554-2625, and then press 5 to make an appointment. Please get vaccinated. Okay, the H1n1 vaccination priorities. There are 3 reasons to get vaccinated. It's a serious disease. Getting vaccinated is the single best way to help prevent influenza, and it helps to protect you, and it also helps to protect those around you. So why these priorities? Pregnant women, because they are at a higher risk of complications and can potentially provide protection to infants who cannot be vaccinated. Children, because of close contact in schools and daycare. EMS and healthcare workers, because of obvious exposure. Young adults, because there have been many more cases of the H1n1 in this highly mobile segment of the population, which includes college-age youth and people with underlying medical conditions. So how do flu vaccines work? Well, I'll give you the Swiss cheese analogy. Every year there are many flu viruses out there infecting people. Getting vaccinated is like stacking layers of Swiss cheese together. Adding layers of cheese eventually stops up the holes and the spread of the potential viruses infecting an individual. Seasonal flu vaccine protects against 3 viruses, and the H1n1 vaccine only protects against the H1n1 virus. There are other flu viruses out there. The vaccine was developed to target the most prevalent and virulent flu viruses commonly around today, which explains why the flu vaccine changes yearly. The global population is in excess of 6 billion people now, so half of the global population will be vaccinated. Vaccine delivery in California. We are now approaching phase 3, which is between January 29th and March 12th. By the end of phase 3 of vaccine delivery, a total of 26 million doses of the vaccine will have been distributed to providers throughout California. That means that 2/3 or 66% of Californians could be vaccinated. Keep in mind the population of California in 2008 was about 36 million people. This is much better than the global vaccination rate of 50%. It is recommended that those people who are allergic to eggs should not get the vaccine because the vaccines are produced in chicken eggs. The types of The types of influenza vaccines available this flu season include a live vaccine, which is a mist vaccine called the live attenuated intranasal vaccine, or LAIV, and then 3 non-live vaccines. The live attenuated intranasal vaccine is sprayed into the nose. The 2009 H1n1 LAIV does not contain thimerosal or other preservatives. It is licensed for people from 2 to 49 years of age. The vaccine is attenuated, which means it's weakened, so it will not cause illness. An inactivated vaccine is available, which is given in the form of a shot. The H1n1 LAIV and seasonal LAIV should not be given together. This is that caveat I was speaking about. The live vaccines should not be given together. However, you can have the live vaccine and then a non-activated vaccine, like the live H1n1 vaccine and the vaccine together. 2009 H1n1 LAIV may be given at the same time as most other vaccines. Okay. Antiviral drugs for flu. There are 2 commonly used antivirals in the US, Tamiflu and Relenza. Please do not confuse Tamiflu, which is an antiviral, with Theraflu, which is an over-the-counter cold medication. It is not an antiviral medication. Both drugs decrease the viral load and reduce the symptoms. Common side effects: Tamiflu causes nausea and vomiting, which can be minimized by taking the medication with food. Relenza side effects are dizziness, sinusitis, runny nose, stuffy nose, cough, diarrhea, nausea, and headache, which are also signs and symptoms that can be due to the flu. Relenza may also cause wheezing and trouble breathing in people with lung disease, so should not be taken by people with a history of asthma or other lung disease. Can children take antiviral drugs? Yes, they can. Tamiflu is FDA approved for the use in children 1 year of age or older, and Relenza is FDA approved for treatment in children 7 years of age and older. But again, for the people taking Relenza, they have to be people without breathing problems. So, lessons learned from the front lines. All of these lessons are really good. I'm going to just focus on some of my favorites. Investments in pandemic planning and stockpiling antiviral medications has paid off. Public health departments did not have enough resources to carry out plans in the past. Hopefully we're learning something from that. School closings have major ramifications for students and parents and employers in absenteeism. Sick leave and policies for limiting mass gatherings were problematic. Even with a mild outbreak, the healthcare delivery system was overwhelmed. If you're interested in additional social media sites, you can go to linkedin.com and then go to the H1n1 Alliance button and find out what other people are thinking. So what might be next? H1n1 is our latest pandemic. The question is, will it be mild or will it mutate over the next few months into something more deadly or virulent? According to the WHO December 4th epidemiological report, so far the virus has remained genetically stable and susceptible to the antiviral treatments which I mentioned earlier. So what does this mean to you? These are possibilities. For a bad flu season, there may be many sick employees, volunteers, and clients from anywhere from 25 to 40%, which will mean there will be higher levels of absenteeism. These will come in waves. There will be possibility of some deaths in your organization's family, and there will be adverse impacts on your organization's operations. There may be a period of normal between the pandemic waves, and your company or agency should reassess its pandemic plan between the waves and modify as necessary. Mathematical modeling conducted this year based on the Southern Hemisphere data suggests that 20 to 40% infection attack rates can be expected just for the H1n1. So if you add that to the seasonal flu, we're talking about the possibility of a lot of absenteeism and adverse effects for your organization's operations. So our action agenda. We need to prepare our organization, and we do this with COOP, or Continuity of Operations Planning. COOP works. Once people are sick, it's too late. Workplace safety tips and office space preparation are very important because workplace safety is everybody's business. So these are some of the things you need to do. Protect yourself, get a flu shot or two, H1n1 and seasonal. Wash your hands frequently. Cover your cough, Dracula cough, or shield your sneeze. Stay home when sick. Practice social distancing when required. Disinfect work surfaces and phones. Limit travel to critical mission activities. Use flexible sick and leave policies. Provide tissues to those who cough or sneeze. Assess the need for personal protective equipment. Post signs on what you want people to do. Things like potty posters, hand washing signs, or nudge notices using hand sanitizers and tissues. These can be found and downloaded off our website at sfcard, and that's www.sfcard.org. It's important to identify your mission critical functions, those operations that must continue. Without them, your organization will not function. It can be integral to a device or system that makes that function possible. What I mean is, for example, Meals on Wheels. Their trucks are critical to their function. So that would be a device. A truck would be a device that is critical to their function. So these things are some of the things that you need to identify. Questions to ask. How is demand for your product or service likely to be affected during and between each pandemic wave? What are your requirements and commitments with suppliers and customers? How might these be affected when the pandemic is at its peak? What circumstances could precipitate a shutdown of your workplace? What trigger will you use to reopen the workplace? Are alternative work arrangements available for employees who are not ill but still able to come in? How will you communicate with your employees at different points in the pandemic wave? What message will you broadcast? Once you start to grapple with these questions, you then need to categorize your employees into 4 different groups. Essential to the work site, essential but can work remotely, non-essential but can work remotely, and non-essential and not necessary to work remotely. Companies must offer their Category 1 employees as much protection as possible. By minimizing the risk they will face at the work site, you will be keeping your critical employees healthy while also reducing the chances that they will refuse to report to work out of a fear of becoming infected. Considerations for human resources. Review and update sick leave policies. Flu absences may be a long-term issue. Staff may be absent due to family members that are sick. Schools and childcare facilities may be closed. But the most important consideration, please, 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 is to stress, don't come to work sick. Guidelines for managers communicating with staff about influenza H1n1. Consider including medical staff, counselors, and peer helpers in group meetings. It's important for staff and families to be given facts about the situation. Note that action is an antidote for feelings of helplessness. Regular briefings in all offices are essential. And also pay attention to what is unspoken and to any staff members who may be withdrawn. Is working off-site realistic? It can be. You need to have a robust work-from-home program. You need high-speed internet connections. The organization needs to provide equipment to do so. You need to work from home at least once a month, and this confirms that a person can actually work from home. And then you need to have alternate plans if working remotely fails. Volunteer management. Precautions for volunteers may be similar to those for staff members in your organization, and be sure to include recommendations for vaccinations to them. Summary of education, very quickly. Influenza basics include staying current on latest information. You can check the CDC information site, the San Francisco Department of Public Health sites, and schedule classes. Workplace strategies and cleaning include keeping waste baskets readily available, keep tissues available, keep hand cleaner or hand sanitizers available. Cover your cough campaign, your Dracula cough that I was talking about earlier, hand washing techniques, polite social distancing. Polite social distancing may not include the optimum distancing of keeping 6 feet apart, but it certainly does not allow for hugging and handshaking during greetings, which of course we all want to do because it's so ingrained in us. A stay-at-home if sick policy, virtual meeting strategies, and strategies to minimize face-to-face contacts with clients. Continuing on, we want to take the time to talk about hand maintenance. Hand washing is most effective. Hand washing done properly is done thoroughly and for the proper length of time, and that is the Happy Birthday song sung twice. Hand sanitizers are nearly as effective as hand washing, but not quite. However, it is a good alternative. However, the hand sanitizer you use must be at least 60% alcohol. And then please follow manufacturers' directions on cleaners, soaps, and especially sanitizers. If it says allow to dry, please do so. Organization education campaign, potty posters I mentioned earlier, desk and wall postings, staff briefings. You can download posters like nudge notices, similar to don't share signs that you can put on phones or other similar devices. Social distancing. Develop guidelines for social distancing, using your floor plans for spreading staff out at least 6 feet from each other, if at all possible. Investigate shift work and weekend work. Avoid shared equipment, and if you have to, clean often if you must share it. So social distancing actually means physical distancing. The impact of social distancing has very clearly been shown to be significant. It delays the outbreak peak, and it decompresses the peak burden on hospitals and infrastructure, and diminishes overall cases and health impacts. Cleaning. Use disinfectants that match the surface's needs. Virus survival. Viruses live on hard, porous surfaces anywhere up to 24 hours. Recently, I have heard from the Department of Public Health that the time frame they're talking about is 2 to 8 hours, but the majority of the information out there is still saying greater than 24 hours. On porous surfaces, it's 24 to 48 hours. Viability of virus is dependent on the temperature of the environment, and we're talking again a temperature range. If it is warmer, the virus is going to live longer, but obviously if it gets too hot, then that kills the virus as well. And Swiss banknotes, it seems to live for up to 17 days. Let's see. So cleaning. In high-touch areas and surfaces, there's a requirement to clean more frequently and more intensely. These sorts of environments are, these sorts of surfaces are doorbells, intercoms, handrails, door handles, door knobs, elevator buttons, steering wheels, common controls, your levers and buttons. Cleaning the infected control workspace. Your top 4 germy office work areas are your telephone, your keyboard or your mouse, your desk surface, and doorknobs. A mouse apparently has approximately, from one report, 1,676 germs per square inch. Keyboard, you can multiply that by 3. Desktop, multiply it by 20. Phones, by 25. So you can see sharing phones is not a good idea. Personal protective equipment. Should you wear PPE? Since the virility of the H1n1 is fairly low and we do have access to Tamiflu antiviral drugs, the Department of Public Health is not currently recommending the use of PPE at this point. However, should the virus mutate and become more virulent, those recommendations may change. Of course, you're always welcome to use your PPE should you so choose. The N95 mask is typically recommended for healthcare workers. Surgical masks are usually applied to sick people as they predominantly help curtail the spread of the virus. What I mean by that is surgical masks protect the public from the wearer, not the wearer from the public. So it's time to prepare. Evaluate your preparedness. HR departments should create and evaluate their plans. You need to adapt to different issues and situations and communicate effectively to your staff, your volunteers, and your clients. It's very important to keep informed. No one knows what is going to happen, and different recommendations will surface, and there will be conflicting information that may go viral out there. It's very important to follow your local Department of Public Health guidance, and to help you do that, I've compiled a list here of ways to keep current. 211 is a good source of information, and it is in multiple languages. Apparently, it took 50 years for the public to get the message that the number 911 was out there to help them in an emergency. So we're really pushing the education of 211. 211 provides free and confidential information and referral. Call 211 for help with food, housing, employment, healthcare, counseling, and much, much more. For the most current local information, you can go to the San Francisco Communicable Disease Department, and I've listed their website. For email answers to your specific questions, you can go to Flu Info, again with the San Francisco Department of Public Health. There is a local telephone number, 415-554-2905, for questions. And then there's a flu hotline from the California Department of Public Health. It's an 800 number. And the Centers for Disease Control also have a good website with a specific swine flu section. And the World Health Organization website also has a swine flu section. So please stay current. All right, any questions?
Okay, so if you have a question, you can go ahead and click the little hand icon, and then we can unmute you. You can also type them in at this time. So we'll give people a moment if they have any questions. See, while we're waiting, I actually have one for you, Elisabeth.
Okay.
Do you know if, I know younger children have to get the 2 shots in a row.
That's correct.
And I know that some pediatricians just got the first shot, but they were still waiting on the booster. What happens if you don't get the booster in time?
Well, you are supposed to get both because that is the best way to ensure that you have the appropriate immune response. If you don't get it in time, you can still go ahead and get it later. Okay. And obviously, you know, we recommend that you get both. However, just getting one may or may not confer the immune response that you want. It really depends on the individual. Does that help?
Yeah, okay. That makes sense. Do other folks have questions?
I know that's an awful lot of information to hit people with at once.
It's a lot of information. I think a lot of people get overwhelmed with all of it too. Any other questions? Here we have one question from Tina. Tina says, have we seen many complications in children from the shots?
No. The severe problems that I've heard of, the life-threatening allergic reactions to vaccines are very rare. If they do occur, it's usually within a few minutes to a few hours after the vaccination. And in 1976, an earlier type of inactivated swine flu vaccine was associated with cases of Guillain-Barré syndrome. But the live vaccine or the nasal vaccine that I was talking about earlier has not thus far been linked to Guillain-Barré syndrome. Guillain-Barré syndrome is the correct way to say it. I can go quickly over who should not be given it, if that helps.
Yeah, that would be great.
Okay. For the live H1n1 vaccine, children younger than 2 years and adults 50 years and older are not to be given the live vaccine. Obviously, pregnant women shouldn't get it. And again, we're talking about just the live one. Anyone with a weakened immune system, anyone with a long-term health problems such as heart disease, kidney or liver disease, lung disease, metabolic diseases such as diabetes, asthma, anemia, any other blood disorders, children younger than 5 years with asthma or 1 or more episodes of wheezing during the past year, anyone with certain muscle or nerve disorders such as cerebral palsy that can lead to breathing or swallowing problems, Anyone in close contact with a person with a severely weakened immune system requiring care in a protected environment, such as a bone marrow transplant patient. Children or adolescents on long-term aspirin treatment should not get it. A life-threatening allergic reaction after a dose of seasonal flu vaccine. And again, it's recommended that those people who are allergic to eggs should not get the vaccine, because obviously the vaccines are produced in chicken eggs.
Okay. Let's see, we have a hand raised from Richard. Richard, I'm trying to unmute you. Let's see if we can hear you. You there?
Yes, I'm here.
Oh, great. Go ahead.
I'm reading online. It's saying that people with egg allergy could have a reaction when given with the flu vaccine, but that they could be administered under certain conditions by experienced physicians. I have someone I know who's not interested in getting the H1n1 vaccine, even though she's older, because she's afraid she may have a reaction. Do you have any recommendation in regards to that?
Again, I'm not a doctor, so I do want to stress that in a particular specific situation like this, the best situation is for your friend to have a conversation with their healthcare provider on it.
Okay, thank you.
Okay.
Okay, I have a question from Juno. She says, do you have any materials that we can use in our centers for human resources to set procedures for staff?
Yes, we do actually. We have on our website a guidance, I'm trying to remember exactly what it's called. It's actually put out by the Department of Public Health. And here it is. It's called Managing the Flu, a Reference Guide for Homeless Shelters, 2009-2010. It's from the City and County of San Francisco, Department of Public Health. And you can download this from our website in a PDF format. And that gives you facilities preparation, client management, staff education, program requirements, resources, flu decision guides, San Francisco urgent care centers, cough alert policies, social distancing and isolation protocols, facility communication sheets, and additional signs, if that helps.
Great. And does anybody else have any other questions? I'm not seeing any hands raised yet. Another moment. Okay, and I don't see any other questions at the moment, Elisabeth, so is there anything else you want to add?
Not at this time. I do want to, of course, add, coming from my public health background, that last opportunity, please go and get vaccinated. That is our best way, prevention, that's our best way to stop the pandemic.
Okay, great. Well, thank you so much for joining us and for providing us with all this information today. And as a follow-up of the call, everybody will get a survey by email. Please take the time to complete it online. And if you aren't already on our listserv, please visit our website to sign up. Thanks for joining today. If you have any questions, you can always contact us at our website is www.familyvoicesofca.org. And keep an eye out for our next trainings. We have an upcoming health summit in March in Sacramento, and registration opened just today if you're interested. And also keep an eye out for next month's Brown Bag Lunch series, which will be on February 3rd at noon. Topic will be circulated very shortly. And thanks again, Elisabeth, for joining us.
Thank you. It was my pleasure.
Thanks, everyone.
Bye-bye.
Bye.